Hello, good morning, everyone, and welcome to the Recovery Housing Institute with Ohio Recovery Housing. My name is Danielle Gray, and I serve as the Executive Director for Ohio Recovery Housing. And today's session is going to be on emergency response and medication policy. And so with that, we'll get started. And so for today's session, we're going to talk about medication policies as well as emergencies policies. And we will go over why medication policies are important and what needs to be included in these policies in order to meet the NAR standards at each level of support. We will discuss procedures for preventing and addressing relapse. I know that you've all had an opportunity to attend a wonderful training by Erin Helms on this topic, on the topic of preventing and addressing relapse. And so we're going to be discussing how to formalize this into your medication policies and to have that in mind when you are looking at your medication policies. And then we'll discuss other emergencies that can occur in a recovery home and describe policies for preventing and addressing them. And to get us started, I've got a poll question here. And so just give me a minute to launch this poll. And so now on your screen, you should be seeing this poll question. You can select your appropriate answer. So which of the following medications may be prescribed to a resident of recovery housing by their healthcare provider? Medication-assisted treatment, blood pressure medication, medication to support mental health, antibiotics, or any of the above. I'm just going to give you about 10 more seconds to get your answers in. I see a little less than half of you voted, so just 10 more seconds for the rest of you guys to chime in and participate. All right. So awesome. 94% of you got the answer right, any of the above. Recovery, I know for many of us, when we think about medication in recovery housing, we think about MAT, which is certainly appropriate because this is something that many residents of recovery housing may be prescribed or they may have interest in or something in your recovery home. And so MAT is certainly at our forefront because it is a medication for people with specific substance use disorders, so specific diagnoses. However, we have to recognize the whole person. People in recovery housing may have other physical, mental health conditions that need to be managed with medication or chronic illnesses where they're prescribed medication. And so we need to think about all of that, not just MAT, while MAT is certainly a critical component and we do need to think about that. And certainly today we're going to go over the medication policies, but there are more in-depth trainings offered by Ohio Recovery Housing that are specific to MAT and specific to really looking at creating a program that's fully supportive of people who use MAT, really dispelling some myths around MAT and providing some education about the rights of residents when it comes to medication-assisted treatment. So if you're interested in that more in-depth training, that's kind of beyond the scope of today, be sure to check out our website. I don't know if we have any currently scheduled, but sign up for our newsletter. We send out training updates and things of that nature, and we'd be more than happy to assist you in connecting to those trainings on medication-assisted treatment. And so this slide is just talking about what I was just saying too. Medication, well, MAT is certainly a medication that many people in recovery may be using as a part of their treatment and recovery plan. It is certainly not the only medication. People in recovery are also people with other, sometimes chronic health conditions, such as diabetes, heart disease, mental illness, high blood pressure, others. And so there are a variety of other medications that a resident may be prescribed or taking. It is important that recovery homes allow residents to work with their healthcare providers to address all of their healthcare needs. And this includes mental health as well as physical health and dental health conditions. And residents may be prescribed a medication at any time. And so a resident may enter into the recovery home and then after working with their healthcare provider be prescribed a medication. And therefore, medication policies need to go beyond just screening and orientation processes, but be implemented consistently over time and consider the changing healthcare needs of residents over time. And when we look at the NAR standards, the NAR standard requires that homes have policies and procedures that address residents' prescription and non-prescription medication usage and storage consistent with the residence level and with relevant state law. And now it is up to Ohio Recovery Housing as the state affiliate of NAR to implement that within the state by coming up with specific requirements that are appropriate for our state. And so in order for homes to meet this standard in Ohio, recovery homes medication policies should first ensure that the home is maintaining an environment that is free from alcohol and illicit drug use. A person who is taking their own prescription medication as it is prescribed is not taking an illicit substance. However, homes should take reasonable steps to ensure that medications are not used by those whom they are not prescribed and that residents are taking their medications as they have been prescribed. Second, the home needs to respect the fair housing rights of residents. Medication policies should also be written in a way that reduces stigma and ensures that residents are supported on their path to recovery. And finally, medication policies need to work in coordination with your other policies and procedures to ensure that any disruptions in recovery are prevented and that your home has a plan in place in case a disruption in recovery does occur. And so your medication policy should be clear that medications are the responsibility of residents. Remember, recovery housing is a housing setting. It is not a treatment setting. Residents may be engaged in appropriate treatment services in the community that help them manage their medications, but this is a separate from the recovery housing service. So especially for people who operate both treatment and recovery housing services, it's important to note that that is separated. So your treatment component, where people might be getting a prescription, they might be getting help managing their medications, even medications might be dispensed at a treatment location if it has the, meets the appropriate standards, that's all fine. But when they are at the recovery house, it is a different location. It is a housing environment. It is not a clinical treatment setting. And therefore, when they're at the recovery home, their medications are their responsibility in the same way that they would be in a private home. It's their responsibility. And so it's important that your medication policy address both prescription and non-prescription medication. Remember, residents get headaches, colds, and minor injuries as well. Be sure to set expectations about non-prescription medications as well as supplements. These can be addressed in the same policy or a separate policy. And we will talk a little bit more about things like supplements and other things. You just want to be, again, you're upholding a drug and alcohol-free living environment, and it's up to you to set those policies. And we'll talk a little bit about how those items are treated differently than prescriptions. But you want to make sure that, again, you're trying to prevent a situation where, someone comes into the home and all of a sudden they're taking this dietary supplement that you're not necessarily, comfortable with having in the house. So you want to, again, make sure it's very clear from the outset, like what types of things are permitted and what types of things aren't permitted. In either way, your policies must be clear about how medications will be stored, how medication is to be handled, and what happens if you become aware that prescription medications or other types of substances that can be diverted are missing within the home. And so first, storage. And this is where things differ by level of support. Level 3 offers, a very high level of support, whereas level 1s are generally not as high of a level of support. So for level 3s, medications must be stored securely. And for level 3 environments, there is expected to be staff present whenever residents are present. And so therefore, it's appropriate to have residents store their medications in a locked room where staff have the key. Processes must be in place to ensure that the residents can access critical medications when they need them. So for example, a resident who may need insulin or an EpiPen should be permitted to have these items on them in case they're likely to be needed immediately for a specific medical condition. However, other medications which, only need to be taken, once a day or twice a day, those can be locked, and then there can be a specific process in place to make sure that the resident can access those medications when they need to take them. And you should also have a process in place to show that the resident medications are not mixed up and that staff cannot access the medications of the resident without the resident being present. So having a system where like that, like what we see most often is like a double locking system. So like there might be a a cabinet or a closet or some sort of storage unit that is locked, and the staff have the key to that bigger cabinet. And then within that cabinet, each resident has their own box, that's a locked box or a safe or something where they have the code to get into their own individual unit. And within that unit is only that particular resident's medication. So the staff member has to be present in order to open, the first door, and then the resident needs to be present in order to open the actual container. Those types of things help you prevent situations where, medication goes missing and it's because, they're accusing the staff of taking it. You don't want that to happen. That really helps reduce that because the staff doesn't have access to that individual box. No one but the resident can open the box, but the resident cannot open the cabinet unless the staff person is present. So it helps reduce those situations, and then it also helps reduce the situations where a resident might be accused of taking somebody else's medication because, again, they can't open anyone else's medication that's in that container because everyone has their own separate locked box and everything is kept separately. And documented separately, so that way, there's no confusion over whose medication is whose, and everything is in their, appropriate containers. And so for a level 2 environment, there's not the same level of staff support, and also residents, and by that time, should be at a level in their recovery where they can reasonably be expected to manage their own medications. And so some level 2 environments are able to offer a system where for medication support where there's a staff person who can lock and unlock the storage and support residents when they need their medication. And if they have the ability to do that, and that's what works for their organization, I mean, that's fine. They can use that, double locked system as well. But for many level 2s, they may not have the staff in order to do that, to meet the individual needs of each individual resident who might need to take their medications at different times, who might need to access them. And so at minimum for a level 2 environment, the residents need to be provided with a locked location for any resident who has medication that may be diverted, such as MAT. And so if there's any medication that has the potential to be, sold, abused, or anything of that nature, the home needs to provide a place for the resident to lock up that medication. And the home's policy needs to be clear about what is to be kept locked up. And I will say that many homes just say any prescription medication needs to be locked. So whether that's, your MAT or whether that's your antibiotics, whatever medications you have, you need to lock them up. And most homes provide a lockbox, but it can be any type of locked storage. It can be a locked drawer. Some homes even provide like lockers. As long as it's secure locked storage, it does not need to be something that's specifically designed to lock medications. And then, of course, things like insulin, EpiPens, things like that, people should be allowed to keep those types of medications on their person just in case, they're needed for emergencies for that individual person's health and safety. And so again, just locking up all prescriptions is something that many homes do just to reduce confusion. And also this increases resident privacy because if they've got a prescription bottle, you just know, hey, that needs to be locked up. It's not somebody looking at it and be like, well, what is this for? And everything, they just know, hey, it's prescription, you need to lock that up and that needs to be secured. And then when the house manager's safety checks of the home, it makes it easier for them if it's all prescriptions need to be locked up, because again, if they see bottles or pills or things of that nature sitting out on dressers or in bathrooms, they can they can quickly be like, hey, that's something that needs to be locked up. You need to lock up your medication, and they don't need to get into the nitty-gritty details of like what type of medication it is and what it's for. They just know that, hey, that's something that's not locked up and it should be when they're doing their safety checks. And then for level 1 environments, residents determine many of their policies. However, at minimum, medications must be put away. So again, when safety checks are completed, medications should be put away out of sight of other residents and visitors. And so many level 1 recovery home residents do decide that keeping their medications locked is in the best interest and safety of the residents, and so they choose to do this. But again, for a level 1 environment, we're looking at people who should have about 6 months in recovery or have completed their successful stays in level 2 or level 3 and been recommended for that environment. They're generally at a point where they can keep track and manage their own medications, and so and they manage that environment themselves, and so it's okay for them to again just put away their medications. But like I said, many level 1 homes do choose to implement a policy where medications must be locked at all times. And medication lock boxes are popular options for recovery homes. These are boxes specifically designed to store medications. However, you are not required to specifically design medication locked boxes. You can use any locked storage that is secure and meets the standards for your level of support. So for example, some homes have lockers with padlocks where medication is stored, and others have locked cabinets or locked drawers. All of these are appropriate. Again, as long as they're locked, they're secure. It means only those specific people who have the key can get into that storage, and no one else can get in. And then the second component of a medication policy is medication tracking. So certainly medication storage policies help make sure that medications are only used by the resident of which they were prescribed. But medication tracking policies also help ensure that residents are taking the medications as they are prescribed, that they're not being diverted within the home, and help you make sure that medication did not go missing and that there wasn't somebody broke into storage or something and took medication. And the level of support for tracking or the level of tracking can vary based on the level of support available in the home. So for level 1 homes, residents complete any medication logs on their own and keep track of their own medications. And so typically logs are only required for medications that have the potential to be diverted. So the resident can demonstrate accountability for taking their medication as prescribed. Homes can help provide residents with tools and training on how to log their own medications and have that be as a part of accountability. If a resident needs or requests additional support, that can be offered. And in level 2 homes, residents also complete logs on their own. However, at minimum, these logs need to be checked by the house manager or other staff on a periodic basis. And so this person must periodically observe the resident, count and log their medication to make sure the count of medication in the log matches the prescription and the amount in the container. So it's up to the resident to be completing their log each time they take the medication, and then on a periodic basis, there is someone who checks that log. So this could be, daily, weekly, whatever's appropriate for that particular resident. I will say that for some residents, like when they first move in and they're, if you have a phase approach in your program, they might be doing these daily checks on their medication every day, and then eventually, checking in every week or something of that nature. But the resident completes the log, and then the staff member observes as the resident, counts their medication and verifies that the amounts in the log are appropriate. And in a level 3 environment, staff observe and support residents as they count, log, and take their own medications each time medications are being taken by the resident. So again, staff should not be handling medication. They are supporting residents as they and providing tools for them to manage their own medications. So those are things like, hey, the reminder to take your medication, the availability to come in and get your medication, and the medication is available when they're scheduled to take it. And then, the staff would unlock the cabinet. The resident would unlock their own medication storage. They would log like, hey, I have 7 pills left. I take 1 and now I have 6 pills left. Count out 6 pills, going back in the bottle, putting the bottle back in the locked storage, locking the storage up. And so staff observe as residents do that and log their own medication, and then make sure that those counts that the resident themselves is counting out matches what's in the log. And so there's a link here to a sample medication log. And there's also one that is available in the Recovery Housing Development Guidebook that is in the handouts section. And so, of course, you are welcome to develop your own. I know some people started using this and they were like, Danielle, this is terrible. We want to make our own. And I was like, that's fine. Other people are like, this is so helpful. I love it. So it's up to you. I think I know I always appreciate having something to start from instead of a blank page. So this is that way to start with something instead of that blank page. And then of course you can edit it to meet your needs. And of course too, if you need, each resident could have a different formatted log too that meets their own individual needs, especially for residents who take many medications. That might be something that's needed for you. It really is something that works. Again, for us, our standard is that, again, you have that log where at any time, you can go in and you can see, hey, there should be, 6 pills left in this bottle. And then you can have the resident count their medication. And if there's anything other than 6 in there, you know that something is off. So that's what we are looking for. And then the rest, you have the ability to make something that works for you. And so your policies must also be clear that staff or house managers, resident leaders, whatever job title they have, are never handling resident medication. So again, if you have a treatment program, that is separate from the recovery house. So whatever happens in your treatment program happens in your treatment program. When people are at the recovery house, that is not a clinical environment. That is a housing environment. That is that person's home. So, so even if someone, handles medication as a part of treatment somewhere else, when they're in the recovery house, it has to be the responsibility of the resident, and they are observing and supporting residents as residents handle and manage their own medications. So they cannot do it for them. So they do not dispense medication. They don't give out medication. They are there facilitating residents to help residents as residents manage their own medication. And this means too that recovery housing staff should not be going to pick up medication from the pharmacy or delivering medications to residents. That is not something that the recovery housing staff should be doing. Again, if that's a different treatment program or the pharmacy offers prescription delivery, those folks are licensed and supported in doing that, but at recovery housing, that is not something that recovery housing staff should do. Recovery housing staff, are more, for the housing environment, not for the treatment environment. And so, of course, a recovery housing, peer supporter or staff person can drive with the resident to go pick up their medication from the pharmacy, ride back home with them, do all of those things, but they should not be picking up and delivering and handling the resident medication. And it's best practice to reinforce this in your staff code of conduct to ensure understanding. And so again, this is about, again, protecting the resident, but it's also about protecting your staff, because you do not want your staff to get accused of like stealing medication, like, oh, they stole my medication when they went to pick it up from the pharmacy. There's supposed to be 30 pills in there and there were only 20, the staff took it. Like, you don't want that accusation on your staff. And so preventing that certainly by making sure that it's crystal clear that your staff should not be handling medication, only the resident themselves should be handling their own medication. And if residents are receiving some sort of medication or support at a treatment center, be sure to have an appropriate release of information with the treatment center and communicate with the treatment team about any supports that are needed at the recovery home. And so remember, it's a housing setting, and so it's separate from your treatment services. And so even if it's the own organization or if it's a different organization that you work with in the community, just do that research and make sure that you have those appropriate releases of information, because information about medication is healthcare information. And then the final thing, this is often missing from medication policies when we do our policy reviews on medication policies, but medication policies must be clear about what will happen if medication goes missing. And it may seem obvious to you or I, but remember, you have an opportunity to make this process crystal clear in your policies, and therefore you should take advantage of it. It can be as simple as if a resident medication is missing, we will implement a policy regarding drug screening and or potential disruption in recovery. So as simple as stating that, like, hey, if we do a medication count and there's medication missing, we're gonna have you do a screening, or we're gonna treat that as if, you had experienced a disruption in recovery, and we're gonna follow that plan. So, or if there's other things that you want that you think need to happen, though you need to write that out into your policy. So, and it's critical that you have policies and procedures in place to educate residents about their responsibility for their own medications and ensure that staff and volunteers understand that they should not be handling resident medication. And so people know from the very beginning that, like, not only do they have to do this logging and locking up their medication, but it's their responsibility. And so if you find that medication is missing, that it's been potentially diverted, that's a very serious issue, and this is exactly how you would handle it. And then residents know that they have to take on that responsibility and what the consequences are of that. And also, again, here too, this is where it comes in that it's a really good idea to make sure that your processes and your policies make it very difficult for residents or for staff where they do not have access to resident medications without the residents being present themselves. Because again, there have been many situations where you've done that count and the accusation is on the staff member. Like, oh, you can't prove it was me because the staff member has a key and they can get my medication at any time. That's where it's very helpful for you to have those double systems where it's not possible for a staff person to access the medication without the resident being. And then your medication policy needs to be consistent with your other policies. And so there are several places to check to make sure that you're being consistent. And so first is your resident code of conduct. And so it's a good idea to include that following the medication policy as a part of your code of conduct. And additionally, many homes also place a requirement in the code of conduct that residents inform all of their healthcare providers, including dental healthcare providers, about their substance use history. So the healthcare provider has full knowledge of the person's health prior to making recommendations about their care. Understand that residents may be hesitant to share such information because people with substance use disorders can and do face discrimination in healthcare settings. And so be prepared to help residents connect with healthcare services with providers that understand the needs of people with substance use disorders. But that requirement and putting that into your code of conduct can be a good way of preventing situations where someone's prescribed a substance that may be potentially dangerous or hazardous to others in the house. And here it was prescribed because the prescriber didn't know that the person had a history with substance use disorders. And so you're just saying, like, hey, living here, you're going to be honest about your substance use history, and you're going to tell all of your healthcare providers about your history with substance use disorders. That can really help them understand that that's something that they need to disclose. And then on your part too, like I said, there's a lot of discrimination, and some healthcare providers, they may not treat them very nicely if they find out they're a person with a substance use disorder. So if you know of good healthcare providers within your community, doctors, dentists, physicians, others, who have an understanding of persons with substance use disorder, and and do not promote stigma against people with substance use disorders, then you can help connect them and provide them with those choices for their healthcare provider. But of course, residents always maintain choice in who their healthcare providers are. And then the next is, of course, your staff code of conduct. Mentioned it several times, but I feel like the more I repeat it, the more likely it is that you will remember it. So be clear in the staff code of conduct how staff are to relate to resident medications. And this includes making sure that staff know that they are not to be handling resident medications at any time, and that they, and they don't access, touch, dispense medication. That's something that is frowned upon, and that there would be consequences if they were ever, if you were ever find out that they were to do something like that. And finally is privacy and confidentiality. Be sure to get appropriate releases of information as needed, and speak to an attorney about your organization structure regarding any potential privacy laws that may impact your organization. We've done previous trainings on privacy and confidentiality, so it's a little outside of today to go into that, but just know, it all depends on your organization structure, where your funding comes from, all of that. And so just talk to an attorney and make sure that you are storing records and data appropriately, and that you have all of the appropriate releases of information that you need. And so I would be remiss if I did not mention fair housing during this section. And of course, you've also all had trainings. You had that legal training on landlord-tenant law as well as fair housing. And I hope you all had a chance to attend that. But this is just from the non-attorney perspective, and from kind of our stance here at ORH. And again, recovery housing is housing, and therefore both state and federal laws apply. And so we had an entire session on fair housing that went into detail about the legal matters. But I do want to take a minute to mention this here as well. And so people who use MAT as a part of their recovery are considered people with disabilities and are a protected class. And so therefore, they have the right to request a reasonable accommodation from a housing provider, policies or practices that can help them gain equal access to enjoy and use a dwelling. And these reasonable accommodation requests can be made at any time, and you have a legal obligation to consider them individually. And when you sign your assurances for ORH certification, you sign your assurances saying that you maintain a process where people, under fair housing law, where people can request reasonable accommodations if they have a disability. And so again, seek legal guidance. I'm not an attorney. And the following guidance that we're going to give here is based on best practice and experience, but legal advice can only come from an attorney. So do not take this as legal advice. I'm not an attorney. Consult your own attorney. But I do want to provide this information from our experience. And so under fair housing law, a person with a disability has a right to request a reasonable accommodation from rules, policies, and practices that will allow them equal opportunity to use and enjoy a dwelling. The definition of disability is broad, so even if they're prescribed a medication for something other than medication-assisted treatment, the medication may still be needed for them because of a disability. So for example, mental health medications. If a person has a condition, they're prescribed a medication, that is also something that you would need to think about. It's different than MAT, but similar in the way that that's a person with a disability and they're using a prescription medication. And so therefore, all operators must have a process for considering such requests. And housing providers must maintain this process where each request is examined on a case-by-case basis, taking into account individual circumstances and whether granting the request is necessary. So again, blanket policies that simply state, we do not accept people who use MAT, or MAT is prohibited here, or X medication, X prescription medications are prohibited here, are not recommended, because you're basically stating that you're discriminating against people with disabilities, and it also implies that you're not willing to engage in the required reasonable accommodations process and have a dialogue with that person. And of course, having this dialogue and engaging in this process does not mean that you must do everything that the person with a disability asks of you, but you must have a process for considering requests that are made by people with disabilities. And prior to denying such a request, the housing provider must engage in this dialogue with the person who's made the request. And so if you've been paying attention about our social model recovery and how we integrate that into every training, this is where the social model recovery comes into. And under the social model recovery, you're creating an environment where residents are empowered and their experience is valued, they're listened to, and you're working with them individually, and they're creating and setting individual goals. So all of these things are embedded within the social model. And so really, engaging in this reasonable accommodations process really does align nicely with the social model of recovery. And so these same skills that you're practicing every day, practicing the social model, are the same thing you need to do when you engage in discussions and reasonable accommodations. And the point of these discussions is to have an honest dialogue, and the purpose for you to explore possibilities and learn if you can reasonably accommodate the individual. And so like the social model of recovery, where an individual experience is respected and valued, you must engage in these discussions each time with an open mind, being willing to listen and work with each individual resident and learning about their individual needs and circumstances. Again, blanket policies are not recommended. And the case-by-case nature of these requirements mean there are many different ways that recovered homes may work with individuals to accommodate them within the home. And we certainly hope that denials or requests for accommodation, that denials of requests for reasonable accommodations are rare, and that you are able to use your skills based on the social model of recovery to work with residents. However, a request for reasonable accommodation may be denied if it was not made on behalf of a person with a disability, there's no disability-related need for the accommodation, or if the accommodation is not considered reasonable. A request is not considered reasonable if it imposes a fundamental alteration in the nature of the program or an undue financial or administrative burden on the housing provider. Again, seek legal guidance prior to denying such requests to ensure you have appropriate documentation to demonstrate that the request was unreasonable. But I do just want to really point this out, like engaging in this process does not mean that you have to say yes at the end, but it does mean you have to go through that process. You have to document that you went through a process to consider the accommodation. And in the end, you determine that the accommodation request was either not made on behalf of a person with disability. I think that one's going to be rare because most people coming to you are going to be people with substance use disorders. So they are people with disabilities. There's no disability related need for the accommodation. Again, I think that one is going to be rare because if they're getting MAT or another medication, generally it's a real nice, clear, direct link that there's a disability related need for the accommodation. But this one, their request was determined to be unreasonable. And so if that request does require you to make a fundamental alteration to the nature of your program, and you can legally make that argument, you can document that and deny the request. And then the second one here, imposes an undue and financial administrative burden on the housing provider, you can document that and then deny the request as well. And so again, this marries like the social model recovery, you engaged in this dialogue, you had a discussion, and it was, determined to be unreasonable, but then also doing your legal component where you're documenting everything to make sure that you demonstrate that you did what you were supposed to do under the law. And of course, when you look at these, it's going to be very different, based on your organization, like what is considered reasonable for a recovery home that it has one house and 8 residents, and what might be considered, a financial administrative burden for that organization is very different than an organization that is connected to a larger, treatment center or has a statewide presence and has, 40 homes. Like what's considered reasonable definitely shifts based on your organization and what is truly a financial or administrative burden. And so this gives flexibility to individuals, instead of saying the answer is always yes or no, but instead you need to go through this process and make this determination, again, based on the individual circumstances, both for the resident and your organization. And I'm circling back here. So again, to supplements, I'd mentioned these as well because your policies need to address prescription medication, but also non-prescription medication. And then I think it's a very wise idea to also consider supplements. And supplements are not considered prescription medications. Like if someone really needs vitamin C or something like that, a doctor can prescribe a prescription for that. But if it's just an over-the-counter supplement that they bought at GNC or CVS, those are not considered prescriptions. And so you can be clear in your policies which supplements are not permitted in the recovery home. And so if there are things like CBD or other supplements that you do not want in the recovery home, you can make it very clear that those things are not permitted within the recovery residence. And it's, again, not recommended to ban all supplements because some people might, want a vitamin D supplement or something like that. Older adults might need to have Ensure or, other medical conditions, they might need those supplements. But certainly thinking about, other supplements and things that, might be hazardous for people with substance use disorder, you can think critically about that and come up with your list of supplements that you do not want to be in the home. And then we always get questions when we talk about medication policies about medical marijuana. And so marijuana is still considered illegal at the federal level. And so Ohio allows medical marijuana, but it is not considered a prescription. It is a medical recommendation, which is very, very different. And so homes that receive federal funding may not support the use of medical marijuana. And even if you do not receive any federal funding, allowing use of medical marijuana may also put in jeopardy any federal fair housing protections that you might wish to claim for your residents. Because again, it's illegal federally, and federal fair housing law protects people who are people with substance use disorders who are in recovery and who are not actively using illicit substances. So once the person starts using marijuana, they may be a person with a substance use disorder, but they're still using illicit substances and they are not protected under federal fair housing law. And so if you have claimed like a reasonable accommodation or anything of that nature from your local community, for the recovery home, and then you're planning on doing that and you allow medical marijuana, you'd be putting that reasonable accommodation that you had received on behalf of your residents at risk. So those are things that are really, really important for you to understand about marijuana. And then also when it comes to NAR, there is a link to a NAR policy guide here, and ORH has aligned, our policies with NAR, where it's at the operator's discretion. So if the operator chooses to allow residents to use medical marijuana, then they can do that, but they must follow all of the requirements that are listed in the NAR policy guide. And so to summarize that here, they must ensure that each resident has valid documentation per state law in order to use the medical marijuana. Combustible cannabis is not permitted. In Ohio, combustible cannabis is not allowable as a medical use anyway, but that's not the same. That's not a requirement in all states. So NAR is very clear that combustible cannabis is not permitted within recovery homes. And then any medical marijuana must be stored, tracked, and documented as any other medication. And then all residents are informed of the policy and they know that this is a home that allows for the use of medical marijuana. And now, again, you do not have to choose this. If you would like to, you can say that medical marijuana is not permitted. That is what many, many homes do. I think we only have one home in Ohio that would allow it, but they do not currently have any residents that use it. So it's at your discretion. And then there is the NAR policy guide as well for you to read if you have more questions on that. And so I'm going to pause here for questions, and see if there are any. I'm not seeing any questions in the question box, but I will give you a second to put some in. Okay, well, there are no questions. I'm going to take that as a compliment that this training is just so clear and easy to understand that you have no questions. But certainly, if you think of one, even if it relates to medication policies as we're moving on, please do put it in the question box. I'll keep peeking at this and have time to answer them. The medication policies are only one component of relapse prevention. And of course, if you've been attending all of our other trainings, you will note that we've discussed many other ways to prevent disruptions in recovery, such as, how to help residents develop positive pro-social relationships under the social model, how to engage in recovery planning, developing an appropriate code of conduct, and how to screen residents and ensure that the level of support is appropriate for that person. And so it is appropriate that we end, for medications on this topic, because pretty much everything that you're doing is helping prevent a reoccurrence of symptoms within the recovery home. I mean, that's what you're all about, is like helping people be healthy and certainly, reducing the likelihood that they would have recurrence of symptoms and hopefully, preventing that altogether. And sometimes operators can do all they can to prevent a recurrence of symptoms, but it does occur. And so like any emergency, it's important to have a plan where if this occurs, that you minimize any harm and ensure safety. And so the importance of ensuring that each property has naloxone and ready supply or residents can access it cannot be understated. And so when we say naloxone must be available and accessible, we mean that, available and accessible. Staff must be trained how to use it, and residents must be offered an opportunity to be trained. And this does not need to be a formal training where you go down to the health department or anything of that nature. It can be as simple as watching the free online video that Project Dawn has, and you just say, hey, we're all going to watch this 15-minute video. And or again, if you want to have everyone attend the in-person training, that is phenomenal too. And residents must be aware of how to contact medical help if there is a suspected overdose or other healthcare emergency, and emergency phone numbers must be posted in the house. And so certainly when we say naloxone is in the house and it's available and accessible, that means that you're not locking that up. So you're not being like, well, the naloxone's in the staff office and we lock the staff office at night. No, it needs to be available, accessible. Residents know where it's at. Many people put it in the kitchen, so it's on top of the fridge in the kitchen, or it's under the sink in the bathroom. Very easily accessible places, where people can access it in an emergency. And anyone can access it, not just your staff. Residents can also access it in the case of emergency. And the best time to discuss a recurrence of symptoms is before it happens. And so best practice is to work with residents individually when they move into the home on a plan for what will happen should they experience a disruption in their recovery. And this plan should be implemented after any immediate medical needs are addressed. And the plan should include who the individuals who you can contact for extra support. And this can include treatment providers, mutual aid supporters, recovery coaches, family members, who are you gonna call for extra support for this person. And then the plan should also be clear about what next steps will be taken. The plan should also include where residents may go if they are unable to stay in the home or if they pose an active threat to the health and safety of other residents. Many plans include staying with a friend or family member temporarily while next steps are determined, or going to a local treatment center if the operator is able to arrange this. In our session earlier, we learned about landlord-tenant law. Remember, it is perfectly legal under landlord-tenant law for the resident to agree to either leave for a time or for the resident to agree to move out. having these discussions in advance can help a resident agree to these terms if a situation does arise. And recovery homes are encouraged to do everything possible to re-engage a resident in recovery housing if they do experience a disruption in recovery. And so before asking a resident to leave the home must consider the circumstances of the disruption and recovery and have the resident screened by a treatment provider, review their prevention plan, and if the home can provide additional supports that are identified by the treatment provider or by looking at what they might need in their prevention plan, and also if the resident is interested in recovery housing. And then finally, look at the impact of the disruption and recovery on the other residents of the recovery home. So all of these things, can be considered after, a person experiences disruption and recovery to see what are the next steps going to be. How are we going to help, continue to support you? And if they can no longer continue to support them, or if they're no longer interested in recovery housing, you must provide a referral to other housing options, treatment or recovery services that may be available to them. And again, this is not just like, hey, we gave you a list and said goodbye, be on your way, but it was you really working with them to be like, we will help you make phone calls. We will, and if you have connections to other people in the community, you are helping to make those phone calls to say, hey, do you have space available? We need help for this person. It's not, again, just you handing them a list of a list of phone numbers and being like, here you go, good luck, you can't stay here. That is not at all what we want to see. We want to see definitely that there's that connection, and ideally what we want to see is that referrals like, okay, there's a space open at this treatment center. We can take you there right now. Do you want to go? Versus like, hey, call the treatment center and see if they can fit you in, right? That's really what we want to see happen. And again, be aware of landlord-tenant law. Seek legal guidance on your policies and procedures from someone who's familiar with landlord-tenant law. So just like doctors, lawyers have specialties. And so it's important that, when you talk to an attorney or somebody with legal expertise, that you're talking to someone who's familiar with landlord-tenant law. Any policies or practices where residents are removed from housing without their consent are likely to be considered a violation of landlord-tenant law. And if you want to remove a resident from housing without their consent or without a mutual agreement between you and the resident, you must follow landlord-tenant law. And that means either filing for eviction in court or following the legal process for not renewing the lease agreement. So providing them notice, and then ending that lease agreement. And then from there, if they still don't move out, then going to court. And so this has generally been a refresher from an earlier training we had on this. I did want to remind you of these few key points. And one of the main things that recovery housing operators are concerned about after one resident experiences a disruption in their recovery is what they can do to ensure they protect the health and safety of other residents. And addressing the situation with the individual resident is critical, but situations should also be addressed as a house. And so, of course, residents have a right to their privacy. But when people are living together as a family, it's common for residents to learn, if someone has experienced disruption in their recovery. And so before sharing any details, be sure to get permission from the resident. And even if you are unable to share the details with others because you do not have permission, there are other steps that you can take to help other residents feel safe. And first is increase awareness. So provide training for staff and residents on warning signs that someone might be experiencing heading towards a disruption in their recovery and what they should do if they notice someone who's exhibiting the warning signs or struggling. Have honest conversations about, disruptions in recovery. Discuss with residents how to be aware of their own actions and how their own actions might affect others who are struggling. And you can also check in with each resident who is currently living in the house, look at their recovery plans, talk to them individually, see if they need more support, and ask them, hey, do you feel like you need additional support? Are there additional strategies that we can think of for your own, prevention plans, and have those conversations and implement those within the recovery home. All right, so are there any questions on, disruptions in recovery and planning, I know you guys all had the training from Aaron Helms a while ago, so this might be a refresher for you. But somebody had the suggestion about, I believe this is Narcan being hung on the wall in the kitchen, so that's a great idea. Again, any place where people can easily find it. So thanks for that suggestion. All right, again, no questions. So I'm going to move on to our final topic, which is looking at emergency and disaster planning. And so, of course, experiencing interruption and recovery and an overdose are certainly the emergencies that recovery housing operators are most concerned about. That's at the most forefront of your minds, just because of the population that we're serving. But of course, there are other types of emergencies and disasters that you should both take action to prevent and plan for in case they do happen. And so similar to preventing disruptions in recovery and planning, for these types of emergencies, you should have policies in place that both ensure that you are doing what you can to prevent emergencies and that you are prepared should they happen. And so safety checklists are one way that you can prevent emergencies. And so these checklists should include ensuring that any safety equipment in your home is in good working order, that any potential safety issues are identified early and addressed. And so reviewing these checklists can help you prevent fires, damage to your home, as well as injuries. And so the American Red Cross and FEMA have created some basic checklists that are designed for use by families. And these are great resources for you to get started thinking about your safety checklists. As we stated earlier, naloxone supply is critical, and so be sure to add that to these checklists. And they are available here, and they're also PDFs that you can download within the handouts section. And there are several safety elements that must be present in the home in order to meet quality standards, and be sure that you should include in your safety checklists. So again, for safety, but also when we walk through for the recovery housing dwelling review, we will be looking for these. First, smoke alarms must be in each sleeping room. So even if your fire department said like, hey, one in the hallway is fine, we're going to say yes, one in the hallway, but also one in each sleeping room. That is clearer than our standards, and so ORH cannot change that. We have to implement it as NAR stated, so one in each sleeping room. And the fire extinguishers need to be by any cooking equipment. So again, it's pretty much like if something lit on fire on the stove, you can grab the fire extinguisher and put that out. And there must be an appropriate location for smoking outside. Either that or the property is completely smoke-free, but smoking must be done outside. Smoking should not be permitted inside the home, including in basements, garages. Again, like your garage, if it's an attached garage or any other building, that can also light on fire and hurt people. So we want to see, smoking outside. Cigarette butts should have an appropriate container. And so I know we are heading, into spring, and, I'm loving seeing, some sun and some daffodils. But I'm from Ohio, so I know the cold weather is not over. And so every winter we notice residents tend to sneak into garages or other places in the home to smoke. So check to make sure residents are not smoking in those areas, because it's a very, very common way that fires get started, and that is certainly an emergency you want to prevent. And then extension cords should be used appropriately. So no using multiple cords or using them to bring power from one room to another. They should also not be run under rugs or create a trip hazard. So prevent injuries as well as fires by not overusing extension cords. And then appliances must be used and stored appropriately. So if your residents are in a typical single family home, there is no reason why they need their own toaster oven, refrigerator, coffee pot, or other heated element in their bedroom with all their fabric clothes and other fire hazards. Therefore, these items should be in the kitchen. This is not only because of heated elements, but also because of electric capacity. In single family homes, bedrooms are not typically wired to have these types of items running, and that may also cause a safety issue within your electrical system as well. Also resident items should be stored properly. And so, for example, if residents are storing items in the basement where there's a furnace or water heater, many homes place like painter's tape or some other marking reminding residents not to place any items for storage directly by the water heater, directly by the furnace, just to ensure that items don't catch on fire. You may also do this in homes that have radiators or other such heating elements where you want to keep residents from storing items, by the radiator, just in case they catch on fire. You can place a little painter's tape or some other marking that says, hey, don't put your stuff within this box to prevent a fire. In an earlier session, we talked about the code of conduct and how a code of conduct can be used to increase safety of the home. And so discuss with residents the following ways that you can create home safety and really think about adding these elements to your code of conduct. So residents agree not to tamper with safety equipment. So residents agree not to take the batteries out of the smoke alarms. They agree not to play with the fire extinguisher, all of those things. Residents agree to refrain from using items that are potentially hazardous, such as candles and space heaters. People can instead use like diffusers, or they can use, other things that don't have open flames, but just asking residents to agree from using those items that can be potentially hazardous. And then residents agree to use and store cooking equipment and food appropriately. So they're not having their own toaster oven in their room, and also food as well is stored appropriately, in the kitchen. It's not being stored in resident bedrooms where there might lead to issues of like mice or bugs or other things of that nature, which can lead to health hazards. And then residents agree to only smoke in designated outdoor areas and dispose of their cigarette trash appropriately. And again, residents agree to store items appropriately. So they're not going to store their items, near the furnaces or radiators. They're not going to dry their clothes on the radiator, all of those things as well. And safety needs to be everyone's responsibility, but often helps to ensure that there's at least one person who has a specific responsibility of using your safety checklist to ensure things get done. And so we've all been in situations where we notice a small thing, such as batteries missing the smoke detector, and everyone thinks someone else is going to fix it. We all think, hey, it's not my job, it's somebody else's job. But that's a potential safety hazard, and it's out there. We've all noticed it, but no one actually takes initiative to fix it. And so in a level 3 home, we suggest adding completing safety checklists to the staff job descriptions. So that way it's very clear whose job it is to complete those checklists and to follow up on any items. So now you might have a building maintenance person who can do things for you, but there's someone's responsibility in their job descriptions to say, hey, you're going to do a safety checklist every month and give any issues that you identify to the maintenance team. And then level 2, it could be in the house manager agreement or resident leader agreement, whoever, that they're responsible for making sure the checklist is done. And now a suggestion might be like they're responsible for making sure that the checklist is done, but they can choose a resident, say, hey, it's your turn this month to complete the safety checklist. And that could be a way of growing resident leadership, having residents take ownership of the house. But again, there's a person who's responsible for making sure that it gets done and that identified issues are addressed. And in level 1, the operator can remind residents to do the checklist and provide them with a copy. And again, if they don't receive the completed monthly checklist, they contact the residents and just say, hey, want to make sure you're safe. You got to complete this checklist so we know everything is safe within the house. And there are some disasters or emergencies that you cannot prevent, no matter how hard you try. And so common situations for you to consider include what happens if the power goes out. What happens if water goes out or the water is not drinkable? What happens if the house is damaged and residents are not able to live there? What happens if there's a gas leak or the carbon monoxide detector goes off? What happens if there's a tornado warning? Other potential disasters. And preparedness is something you need to consider on an ongoing basis. And so set aside a time in resident orientation to consider any specific needs of a resident. So for example, if a resident has a mobility impairment and may need help leaving the home in case of a fire, make sure the others in the home are aware and know that they should help. Or if a resident has insulin that needs to be refrigerated, that you have a plan in case the power goes out and the fridge is not working and they still need to keep their insulin cold. And you should also ask the resident for any emergency contacts when they move in. And we highly recommend making sure this number is correct and accurate. And if the residents stay for a while, double check these to ensure accuracy over time. And it's a good idea to put together emergency preparedness kits. There are links on this slide for the Red Cross emergency response, as well as a first aid kit. Once again, these are great places to add naloxone to be sure you have some on hand. And you can never have too many reminders to ensure that you have a supply of naloxone in your home. And so be sure to check your supplies when you perform your other safety checks and ensure that you have everything and that everything is in good working order. Again, these are just lists to get you started, some suggestions that are based off of emergency preparedness lists for families. And so they're also very helpful for thinking about a group of recovery housing residents. And then disaster preparedness plan only works if everyone knows about it. And so certainly, go over it during orientation, but residents go over so much new information orientation. And so while it's critical that the information be introduced at that point, plan on reminding residents later as well, just to make sure they understand. Post the emergency numbers where people can see them and not forget them. A fridge magnet is a great idea to have those emergency numbers posted on the fridge. And then also place all of your emergency protocols in a binder on a bulletin board of some kind in a common area of the home so people know what they are. And in case something happens, like, oh, the power just went out, we can look in this binder and see what we're supposed to do. And then know your community. I know thinking about disasters emergencies can be overwhelming, but understand that you're not alone. There are organizations out there that can help, that you can partner with to help you. You can visit the Ohio Emergency Management Agency to find your local emergency management agency. And we suggest you sign up for and check out their newsletters. Also check out your local Red Cross or other organizations. They may offer free trainings or advice to your organization on how to do disaster planning, and emergency response within your organization. So we certainly recommend that you take advantage of these resources. We never like to think that anything, will happen, but we certainly know, we've seen in this state, just in recent history, there were tornadoes in Dayton, a few years ago. There was a situation several years ago now in Toledo where, there was contamination in the microcystin in the water. So these things can and do happen. And so it's good to have a plan in place. So that way, when it happens, you've got a policy that tells you exactly what you should do to follow up. And so here I'm going to open up for any final questions that you might have. Okay, well, it's a very quiet group today, no questions. So we were able to get through this pretty quickly, and I know you probably all appreciate a little bit of extra time on a Wednesday. If you are interested in doing your homework assignment for this Recovery Housing Institute series, you can create a medication policy and emergency policy. You can complete those, and we will review your policies and give you feedback at any time. But we'd appreciate them by June 5th. So we have, so we know, like, hey, these kind of group things together helps us manage our workload. But if it's August of next year and you want us to look at your medication policy, emergency policy, we are happy to do that. And, again, please include a message with your attachment. Sometimes people just send us random things and we don't know why. So it's helpful to have that. And so thank you very much for attending today. Again, I'm not seeing any other questions, so you can all have a little bit of time back in our day. We hope to see you at a future Ohio Recovery Housing training. And like we said at the beginning, you'll be getting a short evaluation to your email to fill out. Please fill that out. It helps us improve our future webinars and learn about what other topics you want to learn about. So thank you again for attending, and I hope to see you on future trainings. Enjoy the rest of your day.